ORBIS International is dedicated to eliminating avoidable blindness and saving sight around the world by providing tools, training, and the technology crucial to quality eye care service. ORBIS is also taking their eye care service to the skies with their first ever flying hospital, an aircraft where doctors, nurses, and technicians fly around the world to give the gift of sight. Here to tell us more about ORBIS is President and CEO Dr. Barbara DeBuono. Welcome to the show.
Thanks so much for having me. It's a pleasure.
Thank you. Can you tell me you're giving the gift of sight. Our sight is very important. It's one of our senses. What does it mean to give this gift to various countries and individuals around the world?
Well, it's quite an amazing thing to restore the sight to an adult and especially to a child. It opens up a world that never would have been available to that person before. Imagine a child who cannot see. That child cannot go to school, cannot read, cannot learn. If it's a girl in a developing country, her marriage prospects are very, very limited, and her economic future and well-being is very, very much reduced. The wonderful thing about what ORBIS is privileged to be able to do is we restore that gift of sight through teaching and training and absolutely hands-on public health education and surgery. So when we restore sight to a person, their whole world opens up. Their economic future is going to be very different. Their prospects, again, in terms of family and marriage are different. Their ability to really make a difference, the kind of difference they want to make in their society, is enhanced tremendously. ORBIS is a 30-year-old organization. We're a humanitarian organization that works in developing countries. We work in 89 developing countries. Wow. We're based here in New York. Over the last 30 years, we've trained close to 300,000 healthcare professionals. And these are ophthalmologists, healthcare technicians, people who are nurses, community health workers. We've taught them how to conduct eye exams, how to provide eye surgery in the area of anything from cataracts to glaucoma to retinopathy of prematurity, just a whole variety of things. Diabetes, which is a growing issue, diabetic retinopathy. We've taught them how to take care of the people in their community who have what we call avoidable blindness. That's blindness that can be treated. That's blindness that can be treated in a way that will enhance and restore sight. And there are 39 million people in the world who are blind, and 90% of them live in developing countries. And 80% of that blindness is completely avoidable, meaning that we can treat it, we can do something about it. Okay. We can restore and give that gift of sight. Now, you mentioned something earlier about our Flying Eye Hospital. We are the only organization that works in this area that has a Flying Eye Hospital. It's a surgical suite inside a hospital, inside a DC-10 aircraft. Wow. That is completely outfitted, state-of-the-art, with the absolutely latest equipment. And what we do is we fly about 5 to 10 volunteer faculty. These are people from all over the world who are experts in their fields. Mm-hmm. We fly them to a particular developing country where we are going to be working and developing programs in, or we already have in-country programs, and they actually do surgery. But what they do is they not only do surgery on patients, and we may do upwards of 10 to 15 patients a day, but we actually teach and train healthcare professionals from those developing countries on the plane with those volunteer faculty. So they're getting hands-on training. They're watching through cameras, through video, right there in the OR, in a classroom. They're actually learning how to do state-of-the-art diabetic retinopathy laser surgery. They're learning how to do cataract surgery right there in the hospital. So we were just recently in Peru. We spent 3 weeks in Peru. Mm-hmm. So we had the hospital go to Peru with, in this case, we had a total of probably about 15 volunteer faculty over this 3-week period. Okay. We had lots of ophthalmologists, nurses, anesthesiologists, healthcare workers who came onto the plane and learned how to do pediatric surgery, adult surgery, strabismus for children, cataract surgery, and we trained over 80 healthcare professionals on state-of-the-art eye care and eye surgery. We then went into the local hospitals in Peru,
Okay.
worked with those same trainees and watched them do surgery in their own hospitals. And again, continued the whole training sequence. And it was a wonderful program. We got fantastic feedback. We worked with 5 hospitals, and as I said, trained over 80 healthcare professionals.
So in the decision to create the eye in the sky, so to speak, what went into that? Was it that you guys are always mobile and you need to travel to different countries, so it just makes sense to have this aircraft that's able to keep you mobile? Or was it that, you know, you wanted to show different technology to different places, and this is a great way to bring new technology and people to different places?
Well, you've actually said it very well, better than I can. Initially, Orbis was created with the concept of taking this hospital and technologies to developing countries.
Okay.
Now, actually, what we do is we do both, taking the technology and the training to other countries, but now we also work in consultation with on-the-ground activities and hospitals and trainees and experts to help those individual countries develop the capacity and the infrastructure that they need to provide high-quality vision care and eye care long after the plane leaves. We don't want to just fly in, do surgery, and leave. We want to fly in, work in cooperation with those local healthcare providers, and then train them to ultimately become trainers in their own country. Help them develop the systems at their hospitals, the equipment in their hospitals, so that they can provide ongoing, long-term, sustainable, high-quality eye care. And that's really how Orbis's model has changed. We started with the Flying Eye Hospital. We still have the Flying Eye Hospital. And we also now have a leave behind, and that is working with those individuals in country. We also work with the ministries of health, and we work with the local ophthalmologic societies, so that there is a true infrastructure to deliver high quality eye care and vision care long after the plane leaves. And our goal now is to go back to some of the countries a year or 2 or 3 later, so that we could see, okay, what was the result of our work? Now here we are 3 years later. How are those docs doing? How are those nurses doing that we trained 3 years ago? How's the hospital performing? What are their outcomes? Are their surgical complication rates reduced because of the training that we together were able to provide to them?
So you're basically, there's this web and this network, and now the next steps are following up to see like how great the footprint has been. So if you could say what was next for Orbis, what's next?
Well, what's next for Orbis is a brand new plane. We actually have been privileged to have donated by FedEx an MD-10, which is again, it's a DC-10 with a different engine and cockpit, one that will require, instead of 3 pilots, and by the way, we have all volunteer pilots. Our volunteer pilots are from FedEx and also from United Airlines. They volunteer and give of their time, just as our faculty do. So we will move from 3 to 2 pilots. We will also have a state-of-the-art cockpit. We as well will have a much easier time of maintaining and keeping that plane current, because more and more we're finding that pilots are trained in digital technology in the cockpit as opposed to manual technology. So we're very excited about as well the fact that this plane will have a very much state-of-the-art advanced operating system that will include modules that will be placed into the plane that again will be state-of-the-art operating theaters that will be able to accommodate our trainees, our state-of-the-art classroom. We hope for it to be all wireless. We hope to be able to really take the technology on the plane and the video conferencing and the real-time streaming of video to a whole nother level with this new plane. And again, we hope to continue to make about 6 to 8 missions or visits or tours every year into countries where we have programs or plan to develop programs.
Sounds like you have a big journey ahead of you, but it sounds like you're more than capable. We wish you all the best.
Thank you so much.